Hello and welcome to this recorded open enrollment presentation for the employees of Epitone for the employee benefits starting November 1st, 2022. My name is Bill Hammett. I am your insurance broker, which means me and my team are in charge of making sure you guys have the most competitive plans available to you as you enroll, as well as helping you throughout the year with questions on how to use your benefits, how to find doctors, if you have trouble with the claims process, if doctors are giving you a hard time. If there's anything that goes on throughout the year, you're welcome to reach out to us. I'm available for some of the bigger issues that you need a lot of help with. If you have issues with claims or finding doctors or just need to find help with finding a plan that works best for you, Rhiannon is available. She'd be a good place to start for that. And then for some of the just basic billing or other things that might happen, including finding a doctor or whatever, Anna is a good resource for you there as well. But we are here for you all year long in support of you having as good of a benefits experience as you possibly can. Quick agenda, we'll talk about the timeline of open enrollment, what open enrollment is, the medical plans available, dental and vision plans. We're going to do a walkthrough on the enrollment portal that you'll be asked to go into and choose your plans, and then where do you go with questions. So let's start with open enrollment. Open enrollment is going to go from October 10th to October 17th. It might need to extend a couple of days past there, but for now we're going to keep that period of time in place. Open enrollment is the time in which you can enroll in benefits, you can waive your benefits. In future years, this will be where you can make changes, you can add or waive your dependents, you can move from one plan to the next. Open enrollment is important because after open enrollment is done, you are locked into the plans that you have until next year at this time. So it is important to make a good decision, to think about it, to take into account everything that might be important to you, so that when you make your choice, you know that you made the right choice for you and for your family for the next 12 months. Now, should you have some sort of what they call a qualifying event, like say your wife or your spouse lost coverage and needed to join our plan, that would be a qualifying event. Or if you decided not to take this plan right now, but then later on wanted to enroll in it because you lost coverage elsewhere, that would be a qualifying event. So open enrollment is important because generally speaking, this is the only time you can make changes to your plan, but there are a couple of instances throughout the year that there is options to make changes. So that's what you need to know about open enrollment. Anything that we do here, any changes we make or enrollments that we do, that would be effective on November 1st. Again, we're asking everybody to complete their enrollment no later than Monday, October 17th. And you will be completing your enrollment online at the Ease Benefit Portal. I think many of you were around the first time that we did the Kaiser enrollment, so I think a lot of you are familiar with this tool. We had to reset it and offer more than just Kaiser, so that's why you will see what you see here. So we have 12 medical plans available. All of these medical plans are going to be in different metallic tiers. So bronze is going to be your lowest cost plans, meaning the least out of your paycheck. You won't pay very much at all for these, but they don't cover you very well. There's not a lot of benefits there. Given how Epitone is paying for such a large portion of the premium, I don't anticipate anybody enrolling in a bronze plan at this time. That bronze plan is really there for future employees once Epitone might need to pay less towards benefits, but for right now, that plan is in there. There's 3 silver plans. Silver is a little bit better than bronze. Silver is going to be a little bit more expensive, but still very affordable, still a very affordable option. Again, Epitone, for those of you enrolling right now, is paying such a large portion of the gold plan that I don't think anybody's necessarily going to need to enroll in silver plans. Then we have our gold level plans. We have one each from Kaiser, Sharp, and United Healthcare. And these are really good plans. These are the ones that the company is paying for 100%. So you'll see these as being the best plans available to you at no cost. And then, of course, there's platinum plans. For those of you that want to spend a few more dollars out of your pocket and buy the very, very best plans available, you're going to want to look at these platinum plans. And then lastly, we have 2 PPO plans. Now, a PPO plan is a plan in which you can see a large amount of providers. There's a lot more doctors available to you. With HMO plans, which would be Kaiser, Sharp, and United Healthcare, HMO plans require that you choose a primary care provider or have one assigned to you, and you always start with that provider first. So every time you need to see a doctor or you have anything going on, you will have to go see your primary care provider first. PPO plans do not have some such requirement. PPO plans allow you to self-refer yourself to specialists in multiple different medical groups. And so if you have some very specific needs for yourself or for a family member and you want to have the most options possible, I think that the PPO plans from Anthem Blue Cross would be your very best option. Okay, so bronze, silver, gold, platinum. As you get up into the better metallic tier, such as platinum and gold, it becomes more expensive, but less is asked of you to pay out of your pocket when you're accessing services. So let's talk about the plan designs themselves. So here we've got our silver level plans, okay? There's 3 different options here, one from Sharp, one from Kaiser, one from United Healthcare. In San Diego, there are 2 major healthcare systems. There is Sharp and there is Scripps. So if you want to see Sharp doctors and go to Sharp hospitals, you're going to need to choose this Sharp health plan. If you wish to go to Scripps providers, you would go with the Alliance plan. This HMO from United Healthcare, the Alliance HMO, allows you to see Scripps doctors. And then, of course, the third network, I said 2 minutes ago, the third network of providers really is Kaiser. So in San Diego, it's Kaiser, Sharp, and Scripps. So if you want to go to Kaiser, you can do that as well. Our silver plans are going to have higher deductibles, higher copays. These are things that are this means that you'll have more out of your pocket and when you're using the benefits. Let's skip to the gold level plan, since I think a lot of you will find yourself at the gold level. So here we have in this first column, Kaiser, then Sharp, then United Healthcare, all right? So Kaiser is Kaiser doctors, Sharp is Sharp doctors, Alliance is Scripps doctors, all right? So you see here, there's no deductible. A deductible is, generally speaking, what insurance companies say, you must pay all of this number before they start paying for any of your services, all right? So having a 0 deductible is a good thing. It means that you, as the member, are never out of pocket in the entire cost of a service or a treatment or a hospital stay. So this is very good. Out of pocket limit, this is the maximum that you would ever be asked to pay in a cumulative total in a calendar year. So all of these numbers that are below here are $35, $55, $15, $16, $1,500, $600, $300. All of these numbers are rolling towards this out-of-pocket maximum of $7,000 for Kaiser and United Healthcare and $6,650 for Sharp. So let's say that I go see a specialist. That's the second number here. So regular is 30, specialist is 35. Regular doctor is 35, like a primary care doctor 35, specialist is 55. So that's a dermatologist or maybe a back specialist or an oncologist for more serious things. Here we have United Healthcare 35 for regular, 70 for specialists. Let's talk about this Sharp Gold plan right here in the middle. If I were to go to the doctor and pay $55 because I saw a specialist, I would then have only $6,595 remaining. So that number is $66.50 minus this $55 copay. If I were to go to go to the emergency room, I'd pay $300. So now it was at $6,595. It's now going to be at $6,295. All right. So the picture I'm trying to paint is that every dollar you spend here is rolling up towards this out-of-pocket maximum. Once you have spent the entirety of this out-of-pocket maximum, then you don't pay any of these copays any longer. You don't pay for any of these expenses. All right. So that's our deductible, which is 0 on our gold plans. Our out-of-pocket maximum, again, this is the most you'd ever pay, is for an individual $6,650, and for a family it's double that amount. Now, what's important to note is that it is never any more than the individual amount. So if it's me and my whole family on this plan and I have a very expensive year, let's say I have $200,000 in medical claims, once I've paid $6,650, then I am 100% covered for the rest of the calendar year till December 31st for all covered services. My family would have the other $6,650. Okay. Office visits, regular doctor visits is the first copay. Specialist is the second copay, so it's a little more expensive to see a specialist. Down here we have diagnostic labs. So if you go to the doctor and they want to draw your blood in order to do some tests on it, that would be $15. If you needed to get an x-ray, that would be $55. All right. You see how these other plans have slightly different copays for things. If you need complex imaging, more specifically, this is a CAT scan or a PET scan or an MRI. These are some of the more popular complex imaging benefits. These are a lot more expensive. And so the copay, again, copay means you pay some, the insurance company pays some. Copay for these different plans is different depending on which plan you're looking at. So for Kaiser, I'd pay $250 for an MRI. At Sharp, I'd pay $175. And at United Healthcare, the Scripps Alliance plan, I'd pay $200. Next line, we have a copay for rehabilitation or habilitation. This would be physical therapy, occupational therapy, or speech therapy. You have a copay across the board. Chiropractic care. This is something that is covered by some, but not all. Notice how Sharp Health Plan does not cover chiropractic. So if this is an important benefit to you, you might want to look at one of these other two plans. Then we get into pharmacy plans. So we have a deductible with this Gold Alliance plan for United Healthcare. What this means is that for brand name drugs, so this $50 or this $100 down here, you're going to pay 100% of the cost for the first $100, and then you will get this $50 copay. So once you've met your brand name drug deductible, you will then pay $50 for tier 2 drugs or $100 for tier 3 drugs. Speaking of these tiers, health insurance companies in America put all of their pharmacy benefits, all of the prescription drugs that they have available in different tiers. So basically, if it costs them more, they put it in a higher tier and it costs you more. So tier 1 is generally going to be your generic drugs. They use the term formulary here. Formulary is really just another name for on their list. So the generic list. Tier 1, this is going to be the lowest cost prescription drugs. Tier 2 is going to be their preferred brand name drugs on their brand name drugs list. You'll pay $40, $35, or $50 after the brand name drug deductible has been met. And then we have tier 3, which is their non-preferred brand list of drugs, and you pay more for that. Kaiser only really has the 2 levels, so that's why it has the same number here, but you'll see here and here on Sharp and United Healthcare, it's a little more expensive. Prior auth, this is prior authorization. So some of these prescription drugs and a lot of these different services you might want to get, they're going to require prior authorization, meaning your doctor needs to check in with the insurance company, let them know what they're trying to do, and then the insurance company will say, give them permission to go ahead and do that. Don't worry about that. Your doctor's office will know how to do all that. Let's talk about some of the more expensive things in the healthcare system. Inpatient hospital services. Inpatient means you spend the night at the hospital. Outpatient surgery in a hospital. Outpatient means you do not spend the night in the hospital. So if I were to need to go to the hospital, stay in the hospital, I'm going to pay a little bit more versus an outpatient surgery. So I just go in the morning, they operate on my knee, and they let me go home that afternoon. That's outpatient. So again, using this Sharp Gold plan here, if you were to go to the hospital on this plan, it would cost $1,500. Now this $1,500, this is for the hospital room you're in, the visits by those nurses, all the equipment they're using. It's basically the room and board of a hospital stay. If you were to leave that room and go get an x-ray, if you were to go get an MRI, now you're getting into some of these other copays up here. And if they take you out of there and do a surgery on you, they're going to hit you for a copay, probably like the $600 number. So the $1,500 doesn't cover everything you need in a hospital stay, but it does cover most of those things. So if I were to go to the hospital and get surgery, and let's say it was 5 days and it was $25,000 of expenses, I'd pay $1,500 for my inpatient hospital services and $600 for the outpatient surgery, $2,100, and that's all I would pay. Right below here is the emergency room. So in America, the most expensive way to access care is the emergency rooms. So you'll see that these copays are much higher at emergency rooms than they are even at urgent care. So urgent care is a really nice, these are facilities that are all around there, not quite emergency rooms, but they do allow you to come in the same day with no appointment and see a doctor. A lot of times it'll take an hour or more of a wait to see that provider, but that's a lot faster than 2 days, 3 days, 4 days, which it could take that long or longer to get a regular doctor appointment. So that would be the copay. Emergency room would be a copay of $300. Urgent care would be $55. And again, everything that you're doing is tracking towards this out-of-pocket maximum. So those are our 3 gold plans. This is where I think a lot of you are going to land, is on one of these gold plans, and they're very, very good plans. So let's talk about our best plans available. So we have our platinum level plans, most expensive, but the best coverage. So for many of you, you'll see that these platinum plans have a cost associated with them. Some of you might not have a lot of needs in terms of healthcare, so you'll probably stay with the plans that don't cost you anything, like the gold plans. But if you have a lot of medical needs, if you have a family member that has a lot of medical needs, you might want to look at the platinum level plans, because again, no deductible, but the out-of-pocket maximums are very low, $3,000 to $4,500. As you'll recall, on our gold plan, it was as much as $7,000 of maximum risk. Here on our platinum sharp plan, the most that we'd ever pay in a calendar year, January 1st to December 31st, the most we would ever pay is $3,000. After we've spent $3,000, the insurance company pays for everything 100%. Okay. So here you see these different plans, much lower copays for everything. Everything is much less expensive. Prescription drugs are cheaper. But notice Sharp puts a percentage in here for hospital, surgery, and emergency room. What this means is you will pay 15% of the cost for a hospital stay, not to exceed $3,000. So let's say you have a very expensive week in the hospital, emergency room. Let's say it's a car accident, surgery, everything. You're on this platinum plan. You would be asked to pay 15% of that. Now, 15% of 100,000, of course, is 15,000. You would not be asked to pay 15,000. You would pay 15% of the cost until you have spent $3,000, at which point the insurance company pays 100% of the cost for all services for the rest of the calendar year. Again, once you have spent, no matter what these numbers say, once you've spent $3,000 as an individual or $6,000 as a family, you will pay for nothing else the rest of the calendar year, which is to December 31st. So if I'm in that hospital stay and it's $100,000, once I've paid $3,000, I don't pay anything else. Let's say I get out of the hospital and a month later I need surgery, outpatient surgery. I'm not paying 15% anymore because I've already paid my $3,000. Okay. Same thing with prescription drugs, same thing with doctor visits. Once you hit your out-of-pocket maximum, you pay zero for the rest of the calendar year. I keep saying calendar year because that's important. Our health plan is going to start on November 1st, but every insurance company, the ones we're enrolling in, as well as every other one on the market, on January 1st, everything starts over from zero. So if you were to meet your $3,000 out-of-pocket maximum in November, you would be free all the way for everything all the way till December 31st. And on January 1st, that number resets to zero. And you will have to pay the copays and the co-insurance all the way up to this $3,000 again. So the way you use that to your advantage is if you have an elective surgery or something coming up, see if you can push that out to January, because that means you'll have the money that you're paying towards your $3,000 out-of-pocket maximum will last you all year long. So if you were to hit that $3,000 in January, then the rest of the year till December 31st, you would pay for 0% of the cost of anything. Lastly, we have our PPO plans. We have two of these, a silver and a gold. These are the type of plans that you should think about if you like a lot of choice. We talked about Sharp, we talked about Scripps, we talked about Kaiser. If you choose any one of those other options, you are going to be stuck in those medical groups. All right. If you choose a Sharp health plan, you're not going to be able to go see a Scripps doctor. If you choose Kaiser, you can't see Sharp or Scripps. You have to stay with Kaiser doctors. But if you choose a PPO plan, you can see Scripps, you can see Sharp, you can see a whole bunch of other providers that are in your network, even outside of the state of California. Okay. You won't be able to see Kaiser with a PPO plan. And Kaiser is you're only eligible to get to Kaiser if you have Kaiser. All right. So that's our PPO plan. Those are all of our health plans. Each of these health plans has a smartphone app. So whenever you enroll in whichever plan you do, once you get your ID card, I strongly suggest that you download the smartphone app, log into your system, and keep that on your phone. These smartphone apps will keep your ID card where you can find it. They will help you find doctors. You can schedule appointments. You can estimate prescription drug costs. You can find your medical records. You can chat with doctors. You can set up video visits. The single most important thing you can do to have a good healthcare experience is download the smartphone app. This will help you tremendously, and I recommend all of you do it. So let's talk about dental. This is a lot more simple. We have one dental plan from Delta Dental. It's a very good one. It's a PPO dental plan, which means you have a very large network of providers that you can see. There is a couple of things I want to point out to you. PPO dental plans have a $2,000 per person calendar year maximum. So with medical, we just talked about maximums, meaning whenever you hit the maximum, you pay nothing else and the insurance company pays 100%. With dental plans, it is the exact opposite. With dental plans, once Delta Dental has spent $2,000 in expenses for your dental visits, they pay nothing else and you pay 100%. This number also resets on January 1st, just like medical, but in this situation, it resets to your advantage. This is very important. If you have dental work that you need done and you enroll in this plan, which I would expect everybody to do so because there's going to be no cost to you right now as Epitone, as some of the early employees of Epitone, you have $2,000 of dental expenses you can spend between November 1st and December 31st, and then on January 1st, you get a whole $2,000 again. So you could theoretically, over the 12 months beginning November 1st of 2022, get $4,000 of dental treatments. So very good for you to do. And what you need to know about that is if you have anything you need to do with dental, I suggest that you get it done as soon as you can, right as soon as you get your ID card, reach out to your dentist of choice and schedule a visit, go in there, get a cleaning, and get any work done that you need to get done. Dental plans also just put everything in different buckets. So diagnostic and preventative, so exams, cleanings, x-rays. If you're pregnant, there's enhanced dental cleaning benefits for pregnant women. This you would pay nothing for. All these services are 100% covered, okay? Basic services, fillings, denture repairs, sealants, even endodontics like root canal, oral surgery, periodontics, this is gum treatment or deep cleanings. This is covered at 80%, meaning you would only pay 20% of the cost for these benefits. And then major services such as crowns, inlays, bridges, dentures, implants, you're going to pay 50% of that cost, and Delta pays the other 50%. So let's talk about vision. We have one vision plan as well from VSP. Vision, you get once every 12 months, you get a $10 copay to get your eyes checked. Once every 12 months, you get a $25 copay for lenses. There's different copays here for premium progressive lenses or custom progressive lenses. There's also a $160 allowance for frames. So the glasses, there's the lenses, of course, that's the glass you look through, and then the frame, what the lenses are situated in. You get a $160 allowance once a year, or you get a $180 allowance for some featured frame brands. So some of the nicer brands have really nice frames. So let's say you want to go get a $400 frame from a Gucci or a Prada or some name brand frame. This policy will offset $180 of that cost. So it's an allowance, meaning anything above that $180 or $160, depending on where you go, you will pay that. So if it's $200 and it's one of the wide selection of frames, you would get $160 of that. So you would just pay $40. If it was a featured brand and it was $200, you would only pay $20. And then you also get a 20% savings on the amount over your allowance. So let's say you wanted a $400 pair of glasses, 180 of that allowance would be used up. So there's $220 left. They would take 20% off of that. So you'd be looking at more like $170, $166, something like that. So that's how that works. This benefit summary is embedded into the enrollment portal for your review. So let's talk about that. So when you enroll, we're asking you to do so through this electronic enrollment portal. I'm going to go through that in just a minute with you. But really, the 9 easy steps to this open enrollment is you'll receive an email that'll ask you to log in. Once you do log in, you're going to click the start button, which you'll see when you get in there. The buttons now are a little more green than blue. You'll continue to follow the prompts. You'll verify your personal information. You'll provide any other documents they ask for. When you get to the section where they allow you to choose benefits, you're going to either hit the check mark to indicate you would like to enroll, or the X to indicate you would like to waive, and then continue. You'll review everything and you'll sign your forms. All right. So let's take a look at that real quick. I want to go into the system here. So this is me signing in. So once I've logged in, actually, let me step back a step. Once I log in, you're going to see this button here that says Start Enrollment. You'll go ahead and click that. It's going to give you an idea of what you need to do and how long it's going to take. Do that. Embedded into this dashboard right here will be this video that you're watching. So you can review it. This will be just a regular YouTube video, as you know, so you can kind of skip through it and get to the part you want. You'll get to your information. Notice all these asterisks here. Anywhere where there's an asterisk, you've got to answer it. You get through all of that. Hire date, continue. You want to list your dependents here. Listing your dependents does not mean that they're enrolling right now. It just means that you're going to be able to see and review the costs of the benefits by yourself, with your family, whatever it may be. So list all your family there. Continue. If you have Medicare coverage, you'd add it. Most of you do not, and you'll just hit continue. Don't worry about that. Then you get into your benefits here. Notice when I get here, it's all gray. So it's asking you to either hit the check mark or the X for you to choose which benefits you want there. If you don't do that, you'll see there's nothing you can really do here. Watch how different that is when I select enroll. I'm going to enroll for everybody. See, now I have these green buttons here that allow me to select it. So here's my cost for Blue Cross PPO, very expensive. This is all monthly rates, okay? So the numbers you're looking at here are monthly. My Silver PPO is a little more expensive, but again, then here I got all my other plans here, most of which are inexpensive or free. So here's all the different plans that we had. Many of them are inexpensive. Platinum plans, gold. Now you'll see when I'm looking at these, I've got all these different benefit summaries here, all right, or all these different links. So if I choose this plan here, I can click this link here to open up a detailed benefit summary. So this will give me a lot more information on these plans, okay? I can click here to go straight to the Sharp website and find a doctor. Looking for the Performance Network, so 92110, primary care specialist, we'll go primary care. So there's lots of them, and you can refine your search in lots of different ways. You can look for hospital affiliations, planned medical groups, gender. We want to definitely hit this accepting new patients because we need to know that they can accept new patients. Sometimes doctors do not accept new patients. Their books might be full, if you will. So let's say this Russell Bennett is somebody that I like. This is who I want to go with. I'm going to click on his name here. Here's all the information that you need to know, all the different locations. And you would take this person's name here. You take this person's name here. Let's see if there's other contract information, locations. Let's see where they're at on the map, the details. You would take this person's information here. Jeez. Copy. You'll notice that once I choose this, you're going to have this section down here. We'll just put this doctor in for each one. And then we're going to jump back and we're going to get his provider ID number here. Copy. Paste. 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 And now we've chosen our doctors. Now, let's say we don't have a doctor that we have in mind right now. We can click this auto assign button and it will automatically have Sharp choose a medical provider, primary care provider for you. So you're welcome to do that. You can change your primary care any first of the month. Okay, so if you anytime during the year you want to change it, you can change it, and you can change to a new medical group and a new doctor the next first of the month. Okay, so that's how that works. Again, more information here on all the different plans. Here's the Sharp mobile app flyer. We talked about how it's important to download the mobile app. So you got that there. And then the summary of benefits and coverages. This is a requirement that everybody open this document. It's a requirement by the Affordable Care Act, which a lot of people call Obamacare in this country. We have to show you as an employee this particular benefit summary. Okay, so you can go through it and all of it listed in the same way. So there's the common medical event, service that you may need, what you will pay, and if there's any limitations or exceptions or anything else you need to know. So here's this pre-authorization information again. So I've chosen my plan, $23.13 per month for my whole family, good deal. I'm going to save that, go to the next page. I'll enroll everybody in dental. Okay, very inexpensive. The company is paying the whole amount. Here's your benefit summary there. You can open it up and review it if you'd like. So I'll give you all the information you need on it. Look, this is just what we saw in our presentation. Okay, customer service, numbers, claims address, all that stuff. Continue. Here's our vision plan. We're going to enroll everybody in it. There's our vision plan there. Continue. Now I look at this to make sure this is what I want. Employee, spouse, one child. Yep. Employee, spouse, one child. If I made a mistake and I didn't want to enroll my child, I could just hit this edit button and it will take me back there. I'm going to go ahead and continue. I'm going to sign forms. So with these sign forms, it's very simple. You're going to type your name and then you're going to use your mouse to sign it. Or if you are on a notepad or on your phone, you can use your finger to sign right here like that. Next, it's just telling you that this is a legal signature, and it will roll you through the entire, all of the different places we need signatures. All you do is look for the green box and click in it, and it will insert your signature. Feel free to go through and look at it. You can see all the information is in the right places. We're going to hit finish signing. And then you can leave us your comments about your experience if you'd like, or you can just hit this finish button here. And now you're all done. When you see this turn into manage enrollment, you are all done with the process. So what do you do now? Keep your eye out for the email asking you to log into the Ease Enrollment portal. Please do that. Your deadline to enroll is October 17th. That's a Monday. If you have any questions or you need any answers, please reach out to us. We'd be happy to help you through any part of this process. You need to find doctors, you need to understand the plans a little better, feel free to reach out to us, and we'd be happy to help. Thank you so much for the honor of being your insurance broker. Thank you for the honor of allowing us to help you with such a special and important benefit. I know a lot of this is confusing. Some of you might not be as familiar with the American healthcare system. So if you need some help walking through it, please reach out to me, Bill Hammett, and I'd be happy to help you with some of that very detailed stuff. Thank you for your time, and I look forward to talking to you.